maybe we can also start talking about what skincare treatments are harmful for skin of color patients, or what needs to be used in like caution on this type of skin.
Oh boy. And I'm sure Marisa and Jacklyn and even Natalie, we've had to eat, whether it's your own patients that have come to you coming from another location, or we've just heard these stories. Number one, I want to talk about lasers. And there's a lot of good technology that's out there. But so many people will walk through a practice door and they will receive these harsh treatments, and the skin is not preconditioned, thus resulting in post-inflammatory hyperpigmentation. I've seen people with tiger marks on their skin, or really deep PIH that is really hard to remove. And the impact that it has on their self-esteem it's disheartening. And then they will throw harsh tretinoins, or let's talk about hydroquinone. They'll throw a lot of really strong products to try to correct that, only resulting in a mottled appearance. So when we're talking about using even some deeper chemical pills, yes, we can get results with acute inflammation to ignite that fibroblast, to generate collagen and elastin, and to help the skin heal and repair. But it has to be short and quick, and the skin has to be able to heal. It's that prolonged inflammation that's the problem. And then when we're looking at ingredients such as hydroquinone, hydroquinone has been the gold standard for really lightening and almost bleaching the skin, depigmenting the skin. And it's been banned in several countries. And the reason why it's been banned is because any concentration over 2%, even 2 to 4%, can cause conditions such as aquinosis, because people overuse hydroquinone. They never take a break. Hydroquinone works to suppress the melanocyte cell by 90%. And that cell is beautiful. It helps to protect the mitochondria of the cell. It helps to protect us from the sun. So just imagine a good cell being put on timeout, if you will, indefinitely. And the causes on the skin, we've seen harsh cytotoxic activity. And then we have, when people stop using hydroquinone, they get this rebound hyperpigmentation. Or if they never get off of hydroquinone, their skin can become resistant to the hydroquinone, therefore leaving the pigment on the skin. So we do have tremendous other alternatives, but it has to be used responsibly. And sometimes we just don't see that, not only in the practice, but patients like the results of the bleaching of the skin. So they'll go somewhere else. Even if the practitioner is telling them no, they'll go somewhere else to continue the usage, even if it's a detriment to them in the long run. Albeit for even one of our chemical pills, for anything where you're getting ready to go deeper into that epidermis, and for you practitioners going down to the dermal level, preconditioning with a tyrosinase inhibitor or a skin brightener, along with a stabilized retinol 4 to 6 weeks prior to treatment, really helps to, it's like a safety blanket, and it really is going to help to enhance your overall the overall end product of the treatment.
Okay.
Yeah.
Thank you.
What, Sharla, if you can talk a little bit about the product line from New Aesthetics, and which ones would be safe for skin of color? Are all of them safe for skin of color? I've actually had the opportunity to use a few of the products. I use the lactoceramide, which I've never had more compliments on my skin this week. By the way, I put it on and I felt it immediately tighten and brighten. And I also changed my foundation, but I honestly don't think it's my foundation. I think it was the lactoceramide. I'm not just saying that because you sent us the products, but I honestly have had with it every day I was getting a compliment. I'm like, honestly, it's this ceramide that I was using. So can you talk a little bit about the product line and which products would be safe for skin of color, not safe for skin of color, or is it all inclusive?
Absolutely. The good news is our entire portfolio is safe for all Fitzpatricks. We're able to treat, and also varying ages too. So if you have someone that's young with acne, as young as 10 to 110, you can use Noon. It's for everyone. We do have 2 chemical pills, our P-Pill 40. Really, it's the P-Pill 40 that's not indicated for, it's only indicated for Fitzpatrick's 1 through 3. But outside of that, our entire line is available for all Fitzpatricks. And in terms of some of the hero products, definitely our lactic portfolio, it gives you that immediate result. Pardon me, I have a little tickle in my throat. I myself have really bad acne. I had cystic acne, and I still always struggled with pustular and papule formation. And my skin never had like the glow, that healthy glow. So I could have the oil, but it never had the sheen before until using Noon. And then we also use in some of my favorite hero products. I love our Double Fight. So our Double Fight, the first side is a 10% lactic acid with a 2% salicylic acid. So the chamber A I'm able to use, and it's going to help to keep my skin has never been this smooth before. And chamber B features our a 13% azelaic with a 10% azelaic derivative and a 5% BPO. So here I'm also helping to hinder post-inflammatory hyperpigmentation, reduce redness in the skin. It has so many benefits, and I love the fact that it's travel safe and I don't have to carry a ton of products with me. Another one of my favorites is our retinol charismas, as Natalie talked about. We have a 1.6 retinol, and we're able to use that because of the DermShield technology. But this 1.6 retinol also features oleopeptide 68, which is a tremendous tyrosinase inhibitor. And we're also adding tranexamic acid. Have you ladies ever heard of TXA?
Yes, love tranexamic acid. Yes.
TXA, we love TXA. So we're adding tranexamic acid to our azelaic formations as well.
Can you talk a little bit about, Sharla, just in general with chemicals and skincare products, what skin of color patients need to be looking out for, or treatments that are not safe for them, coming from an esthetician's perspective?
That's a great question. Okay, so in terms of ingredients, I would advise patients of color, if they are going to use hydroquinone, that they need to be their own advocate. You should only be on that no more than 3 months. And if your provider has not followed up with you after that 3 months to tell you what your next step is, then you need to put it on your calendar and you need to contact them. And many people now are opting to not use hydroquinone. We do know that the CARES Act passed in 2020 and that different states are actually outlawing the use of hydroquinone itself. So that is the one ingredient that I would really advise for people of color to be cognizant and be vigilant if you are going to use that. Also, even tretinoin. So I love vitamin A. Tretinoin is prescribed. It's the most widely prescribed skincare product in the world because we know that vitamin A has tremendous benefits. But staying on a tretinoin for an indefinite period of time is actually going to have an adverse effect on the skin. It's not a true term, but we call it inflammaging, because tretinoin dehydrates the cellular walls as it's going in. And so you're getting this prolonged inflammation. Now, if you're a person of color, you tend to have thicker skin, so you might not notice the redness as someone with thinner skin may notice, but it's too much inflammation all the time. So if you are prescribed a tretinoin, you should only be on that no more than 5 to 7 months max. That's the beauty of using a retinol. A retinol you can use all the time because it has an oil ester that conditions the cellular wall as it's going down. So it's not causing that inflammation in the skin. So those are two things that I would recommend that people, if they utilize them, that they need to be their own advocate and know that they shouldn't stay on them for a long time. If you're a healthcare provider watching this, when someone purchases anything like that in your clinic, set a follow-up appointment 3 months. Even if it's a call, just schedule it as an appointment so you can make sure that you're taking care of that patient, because none of us are going to, you see so many people, it's hard to remember, right? I have had Clear and Brilliant, which stays in the epidermis, and that has worked beautifully in my skin. But I would just always say just do your research and proceed with caution with laser treatments.
Yeah, that's something that Jacklyn and I are working on our page, is putting guides out there, and on our website just listing the lasers that are safe for darker skin types, because there's just so much to choose from, so many lasers, different names, Clear and Brilliant being one, and consumers don't know. They see these beautiful before and afters.
And they think it's for them.
And they think it's for them.
Mm-hmm.
Right. So that's something that we're actually working on is just building a library for consumers and also for providers.
And I would also say even chemical pills. So
Mm-hmm.
there's some popular ones that are out there. I've worked for beautiful lines that had good chemical pills. Do not get a chemical pill if you're not preconditioned. And this is really for all Fitzpatricks. What we mean by preconditioned, you should be on a retinoid, could be a retinol for at least 4 weeks, so your cells know what to do when they receive that information. And if you are a Fitzpatrick 3 or above and you're going to get a chemical pill treatment, make sure we have a product called Double White or azelaic acid, something to or vitamin C, but something to suppress that melanin activity is key.
Dr. Sarah mine, but I have a starter kit. Thank you, Natalie, for sending it to us.
Yes,
And
thank you so much.
Yes, you guys are amazing. Thank you so much for taking the time out to talk with us. And yeah, this is fun.
Anytime.
And we're here to support you and your platform in any way that we can. It's very exciting. I know that you guys are going to explode as each day goes on. You're doing something incredible, and the industry needs it, and I know we'll appreciate it.
I love it. I hope every clinic needs to sign on to your Instagram page.
Yes.
It's a beautiful wealth of information. And you know what? It's so simple, right? I mean, the techniques, if everybody just adopts and understands what to do, it's so easy to integrate into their practice. So thank you, ladies, for being a true champion in this arena.
Thank you. Yeah, this all evolved just this past year. I mean, we met at a conference in January, and we both reflected on the lack of education with treating skin of color. And we were just like, why don't we start a platform? Why don't we start a social media page? And it's been a lot of work. Jacklyn's probably put in more work than I have, but
oh no, I think you put in more work than me.
But we're excited we're just taking it as it goes. I mean, people have reached out to us, like Natalie and Sharla. You've reached out to us as well, and we just know that there's a need for education, and we're so ready for it, and we just want to be able to, it shouldn't be a struggle to find out how to take care of skin of color. It shouldn't be, you shouldn't have to dive deep into textbooks. You shouldn't have to go to a conference and sit there thinking after that lecture, they didn't really talk about skin of color because those lasers are not safe on darker skin types. Right. So I think that's kind of how it all came about.
So I would like to ask,